Hi friends. So we'll be discussing, some of the patients commonly ask me because I do a lot of endoscopic surgery and laparoscopy. What are the costs of laparoscopy? So this really depends on a lot of factors. It doesn't really, there's no one fixed cost of a laparoscopic surgery. So, but two or three of the important factors are, first of all, one really has to know what type of surgery this is. Is it a very simple surgery? Is it just a diagnostic surgery? Are we just putting a camera inside and just seeing what the patient has and potentially maybe operating later? Or is it a very major surgery that, is extensive, will take time, might need additional equipment, might need additional people to assist during the surgery? Sometimes a laparoscopic surgery goes on for hours and needs multiple people, maybe 4 or 5 surgeons at a time. So the cost really depends on what are the requirements for that surgery. So first, the simplicity or the complexity of the surgery. Second, the requirements as far as personal equipment goes. The third is, of course, where the surgery is performed. Usually, if a surgery is performed in a smaller nursing home, the overhead charges are much less. If, of course, these surgeries are performed in corporate hospitals, the hospital itself levies a charge which is additional and can be has to be borne by the patient. Now, regarding the payment or costs of these, usually the even in nursing homes as well as in corporate hospitals, one can claim this under insurance. Usually there are certain companies or certain employers that have a list of hospitals where the patient can go and get reimbursement or cashless treatment. So this can be availed of, and this can be seen as what is convenient for the patient. So this is regarding really the costs of laparoscopic surgery. Another question that I'm commonly asked is, when I'm doing laparoscopic surgery, how many stitches am I going to get? And what is really the benefit of laparoscopic surgery over other types of, it could be open surgery or even surgery through the vagina. So first and foremost, let me take an example of a hysterectomy. Ideally, as far as possible, surgeons like me prefer to do a hysterectomy through the natural orifice, that is the vagina. So there is no really any cut on the abdomen, no marks of laparoscopic surgery on the abdomen. And everything is done through the vagina itself. This is called a surgery through the natural orifice. So we usually assess whether this uterus can be removed from the vagina. If the surgery can be done through the vagina, that is always the first option. The second option is either doing an open surgery. Now, usually this is done in very difficult cases, when it is not possible but through the vagina as well as through a laparoscopic route. Maybe the surgeon is not very experienced in laparoscopy. So in case of open surgery or a laparotomy that a surgeon will say, one makes a cut. It could be a horizontal cut at the lower end of your belly, or it could be a vertical cut which is made in the middle or the midline below the belly button. Now coming to laparoscopic surgery, when someone asks how many marks am I going to get for a laparoscopic surgery? So this really depends on the surgeon's how he operates, he or she operates, and also on the complexity or what the problem is that we are dealing with. If it's a very complex problem, if it is, say, a condition such as endometriosis, if it is a laparoscopic hysterectomy, one might get 3 or maybe 4 punctures. If one really needs to retrieve a specimen, sometimes there might be additional marks. So one has to approach a surgery remembering that there is a possibility that one may need to convert it to an open surgery. So a laparoscopic surgery, if it is a diagnostic case, if it is just a small, maybe a cyst, one might have 2 or 3 punctures. If it is a very complex case, the punctures might extend to about 4 or 5, depending on the surgeon and the complexity.